when surgeons study rhinoplasty, there are ideals that we're taught, and they aren't so much geometric absolute. So it's not that the tip should be this many millimeters or the nostril should be this many millimeters or centimeters, but it's more to do with ratios and looking at the nose in relation to the rest of the face. So, for example, there's the rule of thirds, where the length of the forehead, so from where the hairline starts to your nose begins, is a set length, and that should be the same as the length of your nose, and then that itself should be the same as from the start of, or the end of your nose, if you like, to your chin. So that's the rule of thirds, to give you an idea of nasal length. The other thing is nasal width. So the width of the nose should be, your nostril should start if in the plane of, essentially, if you were to drop a vertical line from the inside part of your eye down, that's where your nostril should be. And so these are kind of relative measures to give us some idea of aesthetic harmony. The other thing is, of course, noses should be symmetrical, but that in itself isn't quite so black and white, because someone's face may not be symmetrical. So when you're looking at someone's nose and whether it's deviated to one side or the other, you have to look at two different reference points. So for example, you can say, right, the center of the eyes is one reference point, and the center of the lips, or the kind of middle of the cupid's bow, is another reference point. And you ideally want those 2 points to be in a straight line and the nose to follow that straight line. But in some people, those may be a little bit off. So the center of the eyes may be off to the right and the center of the lips slightly off to the left. So then if the nose was plumb straight, it would look in the wrong position compared to the center of the mouth. So these are all this kind of like nuances, if you like, that I will try my very best to explain, during the consultation, and how it relates to you, as an individual.